Rwandan National Neonatal Protocol Non-Electric Infant Warmer with Marthe Kubwimana.
My name is Marthe Kubwimana. I'm a research nurse with Partners in Health inshuti mu buzima in Rwanda. I'm going to teach you how to use an infant warmer that is designed to complement Kangaroo Mother Care KMC. It is easy to prepare, use and clean. It allows access to the baby for medical assessment and treatment. It does not require electricity to work because the heat source is hot water, which can be prepared by any means, including coal or fire. It's inexpensive and can be reused multiple times. It's made out of wax that turns from the liquid to solid phase at 37 degrees, which is skin temperature. When it is at the temperature when it changes phase, it stays at that temperature for about 6 hours. KMC is the ideal way to provide warmth for stable premature, low birth weight babies. However, there are 3 instances in which KMC may need to be integrated into an additional support system by adding the option of the infant warmer. The first situation is when KMC does not provide an adequate source of heat or for hypothermic baby to attain and maintain a normal temperature. This can occur when babies are at the more extreme end of the prematurity and low birth weight, typically those less than 28 weeks gestation and under 1 kilogram. In those circumstances, the infant warmer can be added to KMC to increase the heat transfer and therefore increase the efficacy of KMC. The second situation is when a complement to KMC helps support the mother of a low birth weight. Premature newborn is when it is not feasible for the mother to perform KMC. For example, if she is ill, delivered multiple gestations, or need to attend the other tasks during which KMC is not safe, such as bathing or cooking. At those times, she can place her baby on the infant warmer, covered with a blanket and weaning her as the warmer lays on a flat surface. In this way, she can know that her baby will remain warm and comfortable while she is temporarily unavailable. Finally, the third circumstance when KMC may not be feasible is when the newborn is ill and needs to be accessible for medical assessment and treatment. In those situations, again, the baby can be placed on the warmer as it lays on a flat surface. The baby can be uncovered, partially or fully covered with a blanket and wear a hat. In those last 2 circumstances, even if an electric source of external heat is available, use of the infant warmer on the mother's bed can decrease the extent to which the mother and the baby are separated. This warmer can be used anywhere, anytime, and addresses or the situations in which KMC is needed to a complementary heat source. The warmer is appropriate to use for any baby who is hypothermic or at risk for hypothermia, and the mother is not available for KMC. It is not intended to interfere with KMC, but rather to support the mothers and families of those caring for premature, low birth weight newborns, to ensure that there is a robust integrated system to avoid hypothermia in those vulnerable patients. Hypothermic infants are those with a temperature less than 36.5 degrees Celsius. Infants at risk of hypothermia are those who weigh less than 500 grams or have a post-menstrual age of less than 32 weeks. If you identify a baby who is either hypothermic or at risk of hypothermia and the mother is not available for KMC, consider using the infant warmer. Pour boiling water into the thermos to the fill line. The water can be boiled in a tea kettle if there is electricity. Otherwise, you can use any other means for heating the water. To prepare the warmer, roll the warmer up and put it in the thermos. Leave the warmer in the thermos for about 30 minutes until the wax in the warmer is completely melted. It will look clean instead of white. When all the wax is melted, take it out of the water and slip it into the ensuring pad, positioning it so that the color indicator is visible. When the color indicator is in the green zone, it's safe to use. This will take about 15 minutes. The baby can either be placed on the warmer and covered in a blanket, or the baby can be receiving KMC and have the warmer in addition wrapped around the baby as back. Either way, the baby should be naked except for heart in order to maximize heat transfer. The warmer can be used until the color indicator drops down into the bottom lead front face zone, indicating that it has become too cold. You will also notice that the wax is becoming solid. It will look white and feel firm. The wax in the middle of the warmer that is in contact with the baby will stay in the melted phase for longer than the wax at the edge of the warmer. Once the color indicator and the color and feel of the wax show that it is no longer warm, the baby should be taken off and resume KMC. The warmer should be washed with standard cleaning wipes, and visibly soiled area can be showered with soap and water. The warmer should be stored in the thermos with the top off. Having completed this chapter, you should now be able to identify circumstances when an infant warmer is useful to complement KMC in order to treat or prevent hypothermia. Prepare and use and clean and store the infant warmer. Properly position the infant on the warmer, naked except for a heart, and use it in addition to KMC or laid on a flat surface. Understand how to use the color indicator to determine when the warmer has cooled enough to safely start using, and when it has cooled so much that it is time to stop using.
Please help us improve the content by providing us with some feedback.